Welcome to the lecture for Providing Care for the Chemically Impaired. So how does one become a substance abuser? There are three factors worth considering which may help us understand substance use and abuse. First is your biological factors. When potentially addictive substances are used, such as alcohol, narcotics, benzos, heroin, cocaine, and amphetamines, these substances causes the release and activation of neurotransmitters, namely norepinephrine, serotonin, and dopamine. Among the three, dopamine may actually stand out. Dopamine, when activated, it is often associated with the experience of something pleasurable and rewarding. Thus, what the brain does is it stores the experience as part of memory. And when dopamine is activated, it can also induce what we call as your neural sensitivity or nerve sensitivity. That is when the same stimuli is presented, the various stimuli that provided a pleasurable experience, it increases the person's urge to do it again or do the behavior again. And that's why this is what you see with addicted individuals to certain drugs, that they keep using the drugs over and over because they try and seek out the same pleasure out of it. When you think of psychological factors, stressful life situations can lead one to use certain substances, and that's basically trying to use a defense mechanism of denial. When you think of socio-cultural factors, think of the acceptance of certain cultures when it comes to using substances. American Indian, for example, uses some form of hallucinogenic drugs during their rituals. And when it comes to Midwestern states, especially in our state, drinking is part of the culture itself. However, when you go to Asia, Asian cultures actually, you seldom see individuals who are alcoholics, and the reason being is that Asians actually have a deficiency in what we call as your acetaldehyde dehydrogenase, or the enzyme that actually helps break down alcohol. And it's because of that deficiency, when an Asian individual actually takes in alcohol, it causes palpitations and flushing. So it's because of that experience, which is a very unpleasurable kind of experience, they try and avoid drinking. So in a given sense, because of the deficiency, the risk of alcoholism in certain Asian cultures decreases. Now, here's one caveat to using substances though. The younger the age or first use of potentially addicting substances, the greater the likelihood of misuse as an adult. And what we have in our state is we do have some sort of an epidemic when it comes to high school students and even younger than high school students using potentially addictive substances. And when they use this for long term, meaning they continue using drugs over a period of time, the risk of affecting their brain actually increases. Because if you think about it, cognitive maturity usually is reached between the ages of 21 to 23 years old. So in a given sense, the younger they use the drug, the greater the risk of affecting how their brain develops. So let's be familiar with some of the basic terms. So what is tolerance? Tolerance is when the physiologic reaction to the drug decreases with repeated administration of the same dose. So what happens here is the person would seek out higher doses of the drug in order to reach the desired effects. Looking at withdrawal, when certain drugs have been used for quite some time and these are abruptly discontinued, Symptoms may occur, and these symptoms can be physiologic, behavioral, cognitive, or even affective. That is the reason why a good number of your drugs, those that are potentially addictive and those that can create condition changes, are tapered off in order to avoid withdrawal symptoms. Now let's compare synergistic versus antagonistic effects. Synergistic effects happens when drugs of the same class are taken together. The effects of the drugs is intensified or prolonged. Now, a good number of your celebrities actually have died because of the mixing together of these drugs. If you remember Seymour Hoffman, Whitney Houston, Heath Ledger, you also have Amy Winehouse. These celebrities have mixed benzos with opiates, alcohol with opiates, alcohol with benzodiazepines, which led to too much CNS respiratory depression causing their death. Antagonistic effect, on the other hand, the key concept here is when drugs are combined, and these are drugs with opposite class, the other drug weakens or inhibits the effect of the other. Examples of which is your opiates or your narcotics. In order to reverse the effects of your narcotics, you give your naloxone hydrochloride. In order to reverse the effects of your respiratory depressant, which is your benzodiazepine, you give your antagonist, which is your flumazenil. If you look at med-surg or your medical concepts, that in order to reverse the effects of too much anticoagulation, such as Coumadin, you give vitamin K. So in turn, these drugs, when they actually are combined, especially in opposite classes, it actually affects the desired effect of the other drug, which in turn, it weakens it. Now let's compare substance abuse versus substance dependence. Substance abusers, while under the influence of the drug, can be described as individuals who can't do with it. That means that while under the influence, they can't fully function. Substance abusers are also those who have the inability to fulfill role expectations, and these roles could be as a parent, as a student, or as an employee. Now, these role expectations are affected even if the person is not under the influence of the drug. So I want you to be careful labeling somebody who can be a social drinker, and these individuals can function and actually fulfill their roles properly. Substance abusers continue to participate in dangerous activities while impaired, and that's why we have so much DUI and OWI cases within our state. And oftentimes their behavior results in legal or interpersonal problems. And despite the recurring of these legal, social, and interpersonal problems, they continue to use these drugs. Now, bear in mind, substance abuse as a term can only be used for someone who has never been diagnosed as substance dependent. Substance dependents, on the other hand, are individuals who can't do without it, meaning without the drug, the individual cannot perform anything. Thereby, they have to have the drug in order for them to function. Now, the use of this drug is no longer under their control despite the many symptoms that they've had. And they start to show and exhibit tolerance and withdrawal symptoms. So when the drug is taken out or they can't take a dose of these medications, that they actually experience withdrawal symptoms. And they had so many unsuccessful attempts to actually cut down or control the use of these addictive substances. Before we talk about codependency interventions, we need to understand what is codependency and what are codependent behaviors. Codependency is a behavior exhibited by family members who are living with the addicted individual. And what codependent behaviors are, these are enabling behaviors wherein the family member feels overly responsible for the behavior of the addicted individual. What do they exhibit? They may find excuses for the person's substance use and feel responsible for their substance use. The family member may also avoid family and social events because of concerns about the behavior of the member with an addiction. The person exhibiting the codependent behavior may assume the duties and responsibilities of the person with the substance abuse problem, whether it is related to parenting or whether it's related to work. And to some degree, when the addicted individual gets into some financial or legal trouble, they actually bail them out. The family member exhibiting the codependent behaviors bail the addicted person out. So in a given sense, it actually enables the addicted individual's behavior to continue because they may see that there's somebody who covers for them. So your overall goal here is to help the family identify enabling behaviors and help them seek support to limit them, as well as help deal with shame, anger, confusion, and guilt. Otherwise, if the family member continues to exhibit these codependent behavior, the addicted individual may not actually gain insight and feel responsible for their own behaviors. The next two slides cover substance abuse comorbidities. Now, these are for information purposes only, and bottom line here is substance abuse over the long term may lead to psychiatric and medical alterations. When you get patients in your clinical setting, there are two simple questions that can help you determine substance use and abuse. One is asking your patient the question, in the last year, have you ever drunk or used drugs more than you meant to? And the second is, have you felt wanted or needed to cut down on your drinking or drug use in the last year? When your patient starts to open up, details should include name of the drug, the route, the quantity, the time of your last use, and the usual pattern of use. The reason being is when your patient comes into your ER and they have certain symptoms, it helps you determine whether there's an antidote or what type of interventions you can provide. Now, always be non-judgmental when asking these questions and always ask in a matter of fact. And always remember, these are questions which can be sensitive to your patients. Some patients can be reluctant to actually answer these type of questions, or some patients would actually tell you that they knew that they would be asked these type of questions. But again, using these two simple questions can help you determine substance use and abuse. Now, assessment doesn't only mean completing your patient's histories, but also completing a comprehensive physical assessment from head to toe. What you're trying to accomplish here is trying to figure out true neurologic versus CNS stimulation or depression brought about by substance abuse. Now, if you have patients who do have intracranial or subdural hematomas or any form of brain injury, these patients may actually exhibit CNS depression similar to a patient with substance abuse. Therefore, try and look at your patient's pupils and differentiate how each respond to light. When you have a true neurologic disorder, your patient's pupils actually respond differently, meaning one pupil will react and dilate while the other one will remain constricted depending on which part of the brain is affected. If you have a patient who is under the influence of a drug, your pupils will react similarly, meaning both pupils will either dilate or constrict when it comes to passing a light. Now, in order for you to further support your assessments related to substance abuse, you may also anticipate getting orders for your blood alcohol level and urine toxicology screens. Your CEWA protocol is used for patients who are suspected of alcohol abuse. Now, please do not memorize what is in your CEWA protocol. Just be familiar with the structure and look at what are the certain areas of assessment that you need to consider. Another tool that you may also use if you have a patient who is suspected of alcohol abuse is your CAGE questionnaire. CAGE questionnaire stands for C is for cutting down, A is for annoyed, G is for guilty, and E is for eye opener. Now, these questions are standard questions. You cannot rephrase these questions. Therefore, when you actually use these questions, use them verbatim.